Believe you have some patient before and after pictures you'd like to show us?
Absolutely.
Let's take a look.
Okay, well, the first patient that I'm going to show you illustrates some of the things that we were talking about already. You can see that a lot of the soft tissue that should have been on the patient's cheeks is now moved down into her neck, and she has a very heavy, very unsatisfactory neck that she's very unhappy with. Her goal was to get some of that weight off of her neck and get it up onto her face where it belongs, and in the process make herself look a little bit younger. And you can see in her first after picture, which is kind of a side shot, you know, we did a magnificent job of getting the stuff off of her neck, and most of her jowls are gone. You can also see that the little line coming off the corner of her nose and off the corner of her mouth is softened, but not completely erased. I think in her case, if we had completely erased them, she might have thought that was a bit overdone. We have two more pictures of her from the front, and again you can see that you know, the terrible problem that she had with her neck. A little bit exaggerated by the fact that, you know, her chin is a little bit short, but still terrible looking neck, and not an altogether bad looking upper face, and reasonable eyelids. She's got good sulcuses on her eyelid, which are the hollows above her eyelids, and overall not a bad face, still nice cheekbones, you know, nice facial structure. And then with the after from the face view, you can see what a great job we did of cleaning up her neck and cleaning up the jawline. Even though in the oblique it still looked like she had a bit of jowls, from the frontal view you can see that the jowls were almost completely erased, much nicer neckline. And as you can see in this next patient, he's got the traditional things that we were talking about. He's got a terrible neckline with a lot of sag in his neck, and he's got the full jowls. You can also see that that line off the corner of the nose and the line off the corner of the mouth are so bad that they're almost obstructing the edge of his nose. And he'd like to have some of those things reversed just to try and make himself look a little bit fresher, a little bit more rejuvenated. And then our after pictures, you can see that we've accomplished pretty much what we said. I mean, a much nicer neckline, a nice hidden scar, and the nasolabial line and the marionette line off the corner of his mouth both look a lot better. And one of the things that I think that's really important for the men is that with the newer facelifts, the minier facelifts, the scar is so much shorter and smaller that it's much easier for the men to accept that scar. And the last patient I have is just kind of epitomizes everything. This is another lady, and you can see that, you know, it's this huge hollow in the mid portion of her face, and that's where her nice little teenage apple cheeks used to live. Now they're gone. Now they're down sitting on her jaw and on her neck, creating all the heaviness in the neck, the heaviness along the jawline. And what she wants is to just turn back the clock. And I think we accomplished exactly what we wanted to accomplish. And you can see in the after pictures, beautiful neckline, beautiful jawline. She still has a little bit of the folds off the corner of her mouth, the corner of her nose, but that's appropriate for a woman in her 50s. If I made her completely smooth, she'd look as ridiculous as some of the Hollywood stars. And she's got some fullness back in her cheeks again. So she's got pretty cheeks, she's got a nice face, nice jawline, nice neck. All of those things resonate with youth, and she's extremely pleased with that. It's not an overdone facelift, it's not an artificial facelift, and it's quick, and she's extremely pleased with that.
Some very impressive results, Dr. Kress, and what I find most impressive from what we just saw in the pictures is the very natural looking appearance from the end results.
Thank you.
Can you tell us about some of the follow-up visits that would, I'm sure, be required for some of these procedures that you've discussed?
Absolutely. I tell people that they can expect then 2 weeks after the procedure to be in the office 5 times.
That's after the facelift?
After a facelift procedure. And we follow our patients very carefully because a lot of things that could potentially be problems can be headed off very early. I tend to leave a tiny little plastic tube hidden behind your ear that wraps around underneath of the skin that almost eliminates bruising, and we take that out first thing the next morning because that's offensive to have walk around with for any length of time. And then, you know, we try to get the sutures out at the earliest possible time, so we need at least 2 more different visits for the sutures. So we do a lot of hand holding, a lot of support for the patients. I think that's extremely important.
Yes, indeed. Now, as far as the fillers, there's no follow-ups that are generally required from those, like Restylane and Juvederm and Radius and some of the others to enhance one's face.
No, but now you're talking about fillers that last a fairly long time. So it's changed the philosophy of the surgeon. With the Restylane, now you're talking about a filler that's going to last you a year. And so for the Restylane, what I usually tell the patient is we don't want to overdo it, you know, because you're going to be living with it for a year if we overdo it. So what I do frequently with them, if I think it's going to take like a couple or 3 syringes of Restylane we'll do them one at a time and let them live with it a little bit. And the other thing about Restylane is Restylane, when it's injected, is not the finished product, because Restylane will pull water out of the tissues and grow a little bit over the next few hours and a few days. So although you were theoretically right that they don't require follow-ups, I do follow them, because my preferred method of using those fillers would be to put in less than they really want, let them live with that for a little while, and then we'll make a decision about whether we're going to add to that.
Less is more, basically, in that sense.
And it's also it makes economical sense to them. I don't want to spend a bunch of their money on something that was more than they really wanted.
I really feel that this was a very, very helpful and informative interview, and I think it was a great way for us to have you on with us for your first time aboard a New Me, and we certainly would love to have you back on, Dr. Kress, on upcoming shows as well, to enlighten us and educate us on other plastic surgery related topics.
Very good. Thank you very much. I enjoyed this.
Thank you again for being a guest today on a New Me.